Hello, team. This is Dr. Taylor Brana, and I'm really excited for you guys to get into this next episode. I had the absolute privilege to interview Dr. Omolara, and she's going to talk about what she does in the introduction to this episode, so I'm not going to get into it, but I want to tell you that I had an absolutely amazing time recording this episode. She had such a fun, energetic personality, and, you know, this is the Happy Doc, and one thing that, of course, you know, I want people that are excited about what they do, that are enjoying their work, and she genuinely has that passion. So it was just very exciting to speak to her and to have this conversation. In this conversation, we're going to talk about what it's like to be a woman of color, to be a mother, and to be a physician in medicine. We also touch on the three things that she needed to learn, voice, vision, and village. Those three things that she needed to learn in order for her to really manage her life more effectively in medicine. And we touch on the projects she's working on. So I really want you to pay attention to Dr. Omolara. And if you're interested, please check out Melanin Medicine and Motherhood, which is her website. She also has a blog and a podcast, so you can find her and look at the great work that she is doing. So without further ado, enjoy this episode with Dr. Omolara.
Yes. Hi, Dr. Brana. Thank you so much for giving me this opportunity. My name is Dr. Omolara Uwemedimo. I am a pediatrician. I've been a board certified pediatrician for about 15 years, and I'm also a work-life integration coach. And the focus of my work is really around improving wellness, inclusion, and retention among women physicians of color, and particularly those that, you know, also are trying to navigate motherhood as well and their careers in medicine.
Amazing. And I'm ready to kind of dig in. I'm going to start off by stating the obvious here. So I'm white. I am not a mother. Okay. I am in fact not even married. Right. And so there's a lot of questions, right, that I can dig in. And I'm also not a pediatrician as well. So there's plenty of angles that we can kind of go into. But something that I'm really interested in right off the bat, you know, lots of people can be a physician. Lots of people can, not everyone, but people go into this field. But not everyone is as ambitious as you and wanted to start or be part of a movement. So I'm curious, what's kind of that story that got you more into this idea that I want to start a website, I want to start a blog, I want to put myself out there? What was that for you?
Yeah, I think it starts actually, it's interesting because for me, I've pretty much been that person who's been taught, put your head in the ground, do the work, and then everything will be fine. And that was pretty much how I moved through med school, kind of tried to ignore certain things that would happen. I would say, after residency, sometimes as attendings, you block out what some of the trauma is during residency. And I think that looking backwards, as I moved forward into my attending career, I am an academic pediatrician. And so being able to now see glimpses of residents and what they're going through pulled me back to think about what were the issues that I was dealing with, but never had an outlet. And specifically as a woman of color, a lot of times your voice is a lot of times muted. And for many of the resident physicians who are women of color, I was seeing that. And I tried to figure out how could I potentially open that doorway, elevate their voice, and also allow for, for us to talk about some of the issues that were happening specifically with women physicians, particularly around the fact that, many of them were dealing with burnout. Many of them were dealing with microaggressions. Many of them were dealing with implicit and explicit bias and racism. And I wanted to create a forum to do that. And so actually in our residency program, we actually created something, it was called Mentor. It was for underrepresented minority residents, not just women, but any residents. And what it was supposed to do was to provide that inclusion, that idea of a safe space where you could talk about some of the issues and challenges which were unique to underrepresented minorities in medicine. And I love that, right? Yeah. But then I realized as a mother, there was this added Like it was like the race. There was the gender, then the race, and then the motherhood.
Yeah.
And specifically for those women who were in medicine and in motherhood, I felt that there was this unique voice that was not basically academia, regular careers in medicine were not listening to, and they were trying to fit themselves in a box around that.
Yeah. I mean, there's so much to tease out there, but something that I'm curious about, again, I have to say, right, I'm in the privileged majority, so to speak, right? So I don't, I had another conversation with a friend about this too. As a white male, I don't even understand, and I can't actually fully understand what you're talking about before with microaggressions and these types of things, because it just doesn't enter my perspective of consciousness, right? So it's not even fair for me to comment on that. But I would be really curious, you mentioned some of these implicit biases, you mentioned some of this stuff. Like, you don't have to give me necessarily a concrete example, but what are some of these, things, even, as I'm mentoring people, what are some of the things that, might come up that we don't even perceive as an aggression, but it can come off that way? And how do we do a better job of teaching holistically? Like, what do you see, like in the actual clinic, in the actual teaching setting? What are you seeing?
Yeah. So it starts with comes together with like. And so if we think about what the medicine looks like, medicine is very non-people of color, right? So out of all of the physicians in the US, 2% are Black women. Okay. Another 2% are Latina women, and less than that are Indigenous women. And so the issue is that a lot of times we're not seen as kind of the norm in those settings. And so I think implicit biases, the biggest one, the first one that I encountered from a medical student was, wow, you're really articulate. And so those kind of things where it's just like, why I've gone to college, med school, I think I should be somewhat able to carry on a conversation, but those kind of things. And so then, multiple women have told me about, of course, being called nurse and being the biases of that, of like, basically the idea of by how you look, that shapes potentially my idea of where you fit and where you don't fit. And so I've had white medical students with me, and the family has talked to them, assuming that they were the attending. And so it's those kind of things that really, after a while, they pile on each other and then start to burn people out, because not only are they managing patients and trying to do their career, but they're managing how to take in these things, hopefully not get aggressive and upset and keep their jobs, and also try to maintain a wellness and a fulfillment in medicine while getting these like little jabs. Somebody there's a video that kind of equates them to mosquito bites, like little mosquito bites that keep happening over and over.
Yeah, and those little mosquito bites, I'm sure, add up, right? And it's like, how do you deal with that? And I'm sure it can be taken to heart and make it very difficult to operate when you get that from people. So, obviously that's actively happening. And I actually had another female Muslim physician. She was actually a surgeon, Callie, and she also a mother, had 5 kids. Actually, I think it was 5 children. So she was like a super mom. And so there's so many different pieces to this, right? But how do we advocate for all people, and of course, women, people of color? Obviously, you are advocating for these people. So what do we do? What are you seeing? What actions can we take to really elevate that conversation?
Yeah, I like the idea of saying action, right? Because a lot of people, if you think about these things, like if we did absolutely nothing, there's a quote about how neutrality, Eli Wiesel talks about it, how neutrality is not neutral, that it takes the side always of the oppressor. So the idea of, if you could think of like one of those moving escalators in an airport, right? That just moving on its way. And if you did nothing, you're still going to move in that implicit bias direction. So you actively have to walk against it. So some of the things that I talk about is thinking from your angle and your purview, who's not at the table? Like whenever you are in something, right? Or thinking or making decisions about like who's not at the table. And we should do this around patients. We've thought about how we do this around bringing patients to the table when we're all physicians. But when we think about leadership and decision making, or we think about even rounds, right? And we think about who's not speaking up, right? Who's not comfortable. Do you have an idea about this to a woman or to a person of color? Because a lot of times we get used to that. Like we get used to, and it's also a shell where it's kind of this wall where I don't want to be perceived as, it's always misconstrued as incompetent and whatever it is, like however it is, or aggressive, like if I actually do speak up. So there's a tendency to withdraw and to not engage. And so really making space, elevating those voices who aren't at the table, always having that idea of thinking about who's not there. And then the second thing I would say is actively trying to make sure that you are knocking down certain barriers that exist within your setting. So if people, I have not heard jokes, but I've been around like people who were my colleagues who were like, this person said this and I had to nip it in the bud. And being that not ally, right, that we hear so much, but being an accomplice who's like, no, I'm not going to comfort you. I'm actually going to address it with the person who did that and break down that structure so it doesn't happen again.
Right. And as we're talking, just to add on, there was a situation recently, I'm not going to go into details about it, but someone in our group was actually labeled a different race or group than what she actually was. And it completely, it was like that micro section. That was one moment where it was very rude. And then no one really said anything, but in the room, it was uncomfortable, right?
Yeah.
And even in that moment, luckily, the person who did that later, actually the week later, actually did address it and bring it up and say, he personally did apologize for that situation. But the one thing that we talked about when that situation happened was the need we should have in that moment addressed it. And in that moment brought it up. And I love what you also said about, thinking about what groups of people aren't there, whether that group doesn't have a female or a woman of color, and trying to, kind of think about it more holistically. I really love that point. Now, I want to steer a little bit over to motherhood for a section.
Okay.
For the second, because I feel like there's just so many challenges that, again, I'm not going to be able to speak about or understand. What is it like? So I don't know how far along it was when you had your first child, but what is it like to go from not having children to having children and being in medicine?
Yes. And I think, I had my children as an attending. I can't even imagine what it's like for people having their children during medical school or residency, of many women who I know who have done that. But I think the biggest thing at that point is now you become hyper aware of all of the structures that are in place that potentially existed really to satisfy the people who were in medicine, which were mostly white men, and how those structures have not actually been very have not been flexible at all. And so the one case in point is the 7 a.m. grand rounds, right? That everyone knows about. And the idea that there are many of us as mothers who want to be there and want to be able to contribute, but have to balance that with the idea of how do we figure out childcare, or how do we figure out how to get our kids to school? While for many who are men, that's the job that a lot of times is being pushed to women. And so it becomes a moot point and not even in their purview. I would say that one of the big things around motherhood for me has been trying to think about that. How do I satisfy the fact that I want to do well in my career, but I also want to do well as a mother? And there tends to be that push and pull about guilt. And so that's why I kind of merged into this work-life integration about how do we do the best that we can to integrate both. There have been times where my kids have been at work and I've just said, this is me, and not trying to say, I am this separate person here and I'm this separate person here, but I'm this whole person, and I have this, and I have this. And how are we going to fit my work to acknowledge the fact that I have all of those parts to me?
Yeah, absolutely. And so what skills or what changes did you have to make? Now I understand you obviously had to integrate everything, but like, how did you change, and what did you have to start to maneuver, think about differently? Like, how do you make it to 7 a.m. rounds? Like all these, there's so many questions I can ask here, but like, what do you do?
Yeah. So I will say that, my journey, because I don't want your listeners to think, well, I had it together right from the beginning. Because literally a lot of my true journey around motherhood and navigating that has been only in the last 2 years. And particularly the biggest journey and the biggest hurdle was the fact that I had run myself. Like I said, I was the person who was always doing. I had run myself into a wall, into that burnout stage, but was not acknowledging that was what it was. I actually last year ended up hospitalized, and I actually wasn't able to walk. And then over a week, I got the diagnosis that I actually had multiple sclerosis. Wow. And which is, of course, an autoimmune condition. We know there are higher rates of lupus, there are higher rates of many autoimmune conditions, and particularly and we know that there are stress relationships to that. And so while I can't say that stress caused that, I can say that it was not helpful. It was not helping the way that I was running myself. And so while on medical leave, while doing therapy, right, to relearn how to walk, I had to let go of my work, which was delegated to 5 different people. And I had to sit down and literally be with myself and reflect on what are the changes I need to make, because stress is a no-no for my condition. And the 3 things I came up with were which is part of my mastermind, which is vision, voice, and village. Vision, which is being very clear about who I am, what I want, what are my strengths, and is my vision, what I'm doing, the things that I'm running myself ragged, are they aligned with my strengths or not? And mastering my minutes around that. The second was a voice, which was really around knowing my no, which is part of knowing what I'm not going to do, knowing what a routine is and how to start to develop those routines and habits. And then also being able to find my fuel, which is really around self-care, which I think more as self-preservation. And then the last is a village. The village is the piece that a lot of times, a lot of us as physicians don't really tap into, because we're supposed to have the answers and we're supposed to be the ones taking care, and feeling like we're burdening people by not asking for that help. So how do you create the village you need? How do you ask for the help and delegate successfully? And then how do you actually start to think about how you can use that network to help in your legacy, in terms of helping you create a roadmap for now futuring, and saying that, okay, where do I want to be in 3 months? What do I need to do now? Where do I want to be in a year? What do I need to do now? So trying to be more future oriented and trying to start to live life a little bit more future oriented, so that it helps you to have that long-term vision and start to relieve like some of that stress around that. So that's
No, and that was really powerful. I mean, you shared so much in there, and I want to thank you actually a lot for sharing that personal story with, obviously having to be hospitalized and the MS diagnosis as well. And then the voice, vision, and village. Yeah. Those are really powerful V's. I like them a lot. One of the things you said there, I think, is really powerful. And I'm glad to have learned this very early, is boundary setting. And I'm curious, in terms of, where you work, are you in a private practice? Are you you're in a private group, or?
No. Okay, so I'm a part-time, I work partly as an academic physician, so I'm based with a hospital. I am actually starting my own private practice, a group practice. It's a practice that's embedded in a community-based organization to provide health and social services. And then, of course, I do this work around motherhood coaching and our mastermind. So, yeah.
So, and so one of the things that came up for me as you were talking about a little bit is, I think, I'll just speak for myself. I feel like for me, there would be a lot of fear in advocating for myself in any practice that I work for, because I think in our minds, there's again, medicine is conservative and all that, but there's a very hierarchical and rigid sort of mentality in practice. And so I'm wondering what strategies you found for because again, for your situation, you had to set those boundaries, right? You needed to reduce the stress. So like, what did you do to kind of navigate that, restructure, and come in and set those boundaries and be really clear? Because again, for you, this isn't just like a game anymore. Like that stress can really,
yes,
hurt you. So
exactly. I think the biggest thing was, I think the first thing for me was recognizing the village and acknowledging them, right? Acknowledging that I wasn't a burden. I actually was offending them when they were asking, how can I help? And I was saying, no, I'm fine. And so the first thing I did was acknowledge who my village was and who are the key people that I needed, particularly around for my work-life sponsorship. And really be who were the people who were in those spaces that could advocate for me. Many being white males who I could feel like I've had a long relationship with and felt like I could be vulnerable. Because I think that's the piece that it's until you actually share that vulnerability, and it's going to be hard for people to really, you can't make that connection. That's something I've learned from Brene Brown mostly, but that idea of identifying who are those people. It's not everyone deserves your story, right? But identifying who those people are, being vulnerable with them about your needs, and setting those boundaries about, this is what I need. How can we get there? Who is the person that you can talk to that I may not have access to, or the ability to penetrate, I think was one of the first things. And that's what I do with my residents as well. Like it all goes up, right? So with my residents, a lot of times when they're struggling, I have to be that voice for them and say, okay, I'm going to take it from here and have that conversation that hopefully will then channel down and benefit you. So that was probably at least the biggest thing that I had to do. And then, like you said, I had to create those boundaries. And a lot of times when people think about boundaries, they think about what I'm saying no to. But what am I saying yes to? What am I making space for? And I had to put in my place, what were the things that I valued that I wasn't spending time with? And what were the things that I didn't value as much that I was like spending way too much time? And starting to say to myself, okay, if this is my value, how am I going to make space for that? And the best way to show value is by how much time you actually spend with that thing. So that was like one example was my kids' calendar. The first thing when we were going into September, the first thing I put into my calendar were my kids' school functions. That was the first thing. And then I said, okay, we're going to work around these. Like these are where my because that was really important to me. And the self-pay. These are my monthly facials. I'm a facial person. My monthly facials, these are when I'm going to put them in. So really being able to say I'm making space for, and then that may mean that I'm going to have to make space from so negative and positive boundaries.
Yeah. So it sounds like, there are a lot of steps. You mentioned the vulnerability, you mentioned, obviously having to form space and being okay with that space. I feel like that's a huge shift. That's a huge shift. Yeah. It's a real struggle. And I think about that, like just really logically, because we've worked so hard. You think about like high school to college, college to medical school to residency. There's no time. We're always working super hard. And actually, so like the huge transition for me from second year to third year residency, this year is the first year we have a lot more free time. And I was confiding in one of my friends. I said, dude, it's so weird because I have time now and I'm really uncomfortable. And yeah, I mean, you're laughing, right? You know exactly what I'm saying. And it's uncomfortable. And so I think that's the big challenge is what do we do when we have that space? And so now I'm curious, you have created that space and there is like sort of getting just comfortable doing nothing too. I think that's part of it too. But like, obviously you're starting new projects and all that stuff. So what has been like, you said you became more organized, you've been scheduling things that are important to you and then working things around that. But what has that space done for you?
Yeah. So I think, it was funny because the 3.5 months, right, of medical leave was like torture, right? I was like, wait, I have nothing to do. This is not possible. Like, it was torture. But what I realized was, what do I want to do? Like, what is it that my brother had asked me when I was in the hospital, what is it that brings you joy? Don't talk about other people and helping other people because we know about all of that. But what actually brings you joy? And I had to sit there. It took me a week to figure that out. But I did realize that it was that socialization with my friends. It was that connection. It was the reading. I love and adore like absorbing knowledge. And now making space to actually do those things and say, these are the things that actually bring me joy that if I had time that I would do and enjoy it. And so, you know, during that space was why I created my Facebook group, which was just like, hey, I'm not doing anything right now. And, you know, and just trying to talk to lots of moms. But then why I created the podcast, because I would just absorb all this knowledge and I was like, where am I going to put it? And so I think, you know, being able, it doesn't mean you don't do anything, right? It means you do the things that you love, right? And you make space for the things that you actually love. And sometimes that is a journey of figuring that out and trying to like find that unique theme of like, when was I at my happiest? Like, when do I doing some back work? You know, It might be in your 20s, it might be, but just trying to get an idea of like, what are those moments? Because yes, medical school, residency, and being attending will cloud those very quickly. And you're like, I see patients and I sleep. That's what I do.
Yeah. No, I mean, that's really powerful to like you said, like getting back to what makes you happy, getting back to what you enjoy. Yeah, really powerful. So reflecting on that journey now, you said you were 15 years into being an attending. Is that correct?
This year is year 16.
16. and so you definitely have done this for some time now. And I'm curious, you know, what's something that, you know, looking back, you wish you would have known sooner, or if you could like inject that into yourself sooner, lesson, or, you know, if you even guided yourself, you know, looking back, what would be something you wish you just, come on, get this in your head? What would that be?
Wow. Okay. There's so much, but I think the future oriented piece of me, like, is really, I think that's what hits the most. And I would say it's probably differs from now being a mother, right? Because when you're a mother, this is going to sound morbid. You start to think about your mortality and you're always thinking about kind of, what are things going to look like for my kids? And that helped me to be more future oriented. But I would say, you know, it depends. So for those that aren't in motherhood, I think the biggest thing is really starting to have those connections and making sure, because I feel like for me, turning the place I can see the burnout happening was when I started to go within and I never was going out, or my time with other people was very superficial and I had nobody that knew really what was going on. And so it's trying to identify and not every friend is going to be that for everything, be there for everything, right? But who is that person you can talk to about the work issues? Who is that person that you can talk to about the care issues? Who's that friend who is like the one that you, as soon as you get on the phone, you guys can act like silly fools, and like that helps, you know? So identifying who those target people are, I think, is the one thing that would really, I think, looking back, that I wasn't doing because I wanted to put up this shell that everything, I had it all together.
Right. So for you, your style of dealing with stuff was to be more isolating. And so like your solution now you know it is, you got to have those core people and to be vulnerable and be real with them so you can kind of recalibrate.
Yeah. And I don't have to tell them everything, and I don't tell anybody everything, but I do have to have some way of like not storing that in. I mean, it really increases our allostatic load, our stress. And we know specifically at least for women of color and people of color, we've actually seen things such as telomere shortening and like shortening of light, which is on the ends of your chromosomes, and actually the shortening of that, where people who are in their 30s, for certain people of color, their telomeres look like they're in their 60s. And this like idea of a potential shortening life expectancy, just because of dealing with all of the things, you know, that we have to. And so, you know, I think that I want for a future for me and for my kids, and I want to be here. And so I think realizing that getting that out may help me physically, not just emotionally and mentally, but it's an actual physical health issue as well.
Yeah, no, that's really powerful. I did not know that about the fact that would actually on the chromosome level impact, especially women of color, and then having kids on top of that. Oh my gosh. It's pretty crazy. So I'm going to leave this space open now. I think we're coming up on time. The question I have for you, and then we'll kind of, wrap things up, is what's something that you're really passionate about that maybe we didn't talk about? And go ahead.
Yeah, I'm super uber passionate, like now feeling like I've found my voice and feeling like I'm not scared of saying what I believe. So I'm really passionate about this issue around these 2%, like, and the fact that if now 50% of medical school entrants are women, why are we at 2% of like Black women? And just realizing that I don't want to be a unicorn. I really would rather not be a unicorn. And now creating the Facebook group, creating the mastermind, and being able to have a space for Black women physicians to congregate, to in the Facebook group, it's more around like networking and just like sharing tools and tips of how you're managing. But in the mastermind, we actually do training on the Vision Voice Village model. We actually do coaching. We actually do accountability partners. We actually do community, like where we talk through kind of what were your wins, what weren't your wins, ongoing. And so I think that has been pretty much the thing that I've been driven to do, brings me joy. And I sometimes have to make sure I create boundaries around not going too deep all the time and making that space. But really thinking about how, if we allow for healers to thrive in all spaces, how better that is for our communities when the people who heal are thriving and then can really take in and bring that to the people who they need to heal. And so I think that is my passion du jour right now.
I mean, I love that. I couldn't agree more. And I would say that, I would argue that the happier, healthier, more energetic you are, the easier and more impactful you are for your patients. And I'm preaching the choir here. So final question, how can people reach out to you? How can they find you?
Oh, yeah. So everything melanin, medicine, and motherhood. So I am on all of the social media. So I'm on Twitter. Actually on Twitter, I'm Dr. Omolara. But if you go to my website is www.melaninmediциnemotherhood.com. And there you'll have all of my handles right there. But Instagram, I'm getting pretty good. So Instagram, I'm Melanin Medicine and Motherhood. And so that's a great place also where I hang out as well. And then I have the Facebook group. So if you're a Black mom physician and really looking for support or isolation, come on into the Facebook group, and guess what it's called? Melanin Medicine and Motherhood. And then I also offer the Mastermind, which is a paid program for moms looking for more in-depth support.
Amazing. Well, Dr. Omolara, thank you so much for your time. I can tell you authentically, I see the smiles. I think we had a fantastic conversation. I certainly learned a lot. I know you are a happy doc. So thanks for being on the podcast.
Thank you so much. I had a blast being on here. Thank you.
All right, guys, if you enjoyed that episode, please share that with a friend. Share that with someone you think who would be impacted by that episode. And if you want to follow us on The Happy Doc, subscribe to our podcast. And if you're loving it, leave a 5-star review. It's one of the best ways to support us. I want to thank you so much for listening to this episode of The Happy Doc, and I'll see you on the next one.